Has anybody heard of the donut hole? So they told us in 2018 that the donut hole, also known as the coverage gap, was going to go away. Well, look, it's 2022. We still have the donut hole. So the donut hole is the donut hole. And it doesn't matter if you get your Part D through a standalone plan or an Advantage plan. Because sometimes people think that the coverage gap is only applies to one or the other, but no, it's the same regardless. So what that means is you could actually pay up to 4 different amounts during the course of the year for your medications. So this is what happens. You'll go get your drugs filled the first time and you pay X for it. And then the next time it's a different number. So you start yelling at whoever's in front of you, which happens to be the cashier at the counter at the drugstore. Well, she didn't do it. Okay, she did not do it. Let me explain this next slide a little bit more. So I hope that this will help you understand why you may pay 4 different amounts over the course of a year. So, number 1 is this year, 2022, the federal government would not allow the deductible to exceed $480. Well, starting in 2023, they're up in that $25. So they can charge up to $505. Now, all of these different insurance companies decide what they're going to charge. Most of them do charge the maximum amount, not all of them. But if your plan has a deductible, regardless of the amount, you will have to pay the full cost of the drug. If you're on usually tier 3, 4, or 5, you'll have to pay the full cost of the drug until you've satisfied that deductible. Once you do that, then you revert to the initial coverage stage. Now, in the initial coverage stage, that's where on your plan you'll see that chart, and it'll have tier 1, 2, 3, 4, 5. Some of them have tier 6 on there, and you'll look to see what tier your drug falls under. And so what they do is they add your tier cost with what the insurance company pays. Now, if those two numbers add up to $4,660, then you go into the donut hole, which is our coverage gap that's known as the donut hole. There, you pay 25% of the cost until you paid $7,400 out of pocket. Should that happen, then you'll pay a different amount. Then you would pay the greater of 5% of the cost of the drug, or $4.15 for generics and $10.35 for any other drug. Now, please note, anytime you see a percentage versus a definitive number, that is Medicare's negotiated rate. And that's the reason why it is so doggone confusing, and you can't figure out exactly how much it is, because we don't know. I never know what Medicare's negotiated rate is. If there's a definitive number that I can identify with, but the negotiated rate is not the full retail cost that you would see if you went on the internet. Okay. When you go to the pharmacy, they have it. The insurance companies know, they're all hooked up. So they know exactly what your drug costs, how many times you've had it filled, yada, yada, yada. Okay. So the next time you go to the pharmacy, instead of screaming at somebody, you can say, oh, am I having to pay my deductible? Do I have a tier 3, 4, 5? And am I just paying my co-pays, my tier cost at this point? Am I in the donut hole? Have I passed the donut hole? So this is the reason why when you go to the pharmacy, you may pay 4 different costs during the course of a year. Now, this is probably about as clear as mud, right? I always tell everybody the donut hole or the different stages, coverage stages, it's hard to understand unless you get put on a higher cost medication and you're actually going through it.